Hi YouTube, my name is Dr. Margolin. We're here at Comprehensive Pain Management Institute. We're for provider pain management practice in Ohio. We provide educational video materials for our patient on topic of opioid epidemic. We got several requests to make this information available to general public. Let me talk for a few minutes on why is it important and why it is of interest to general public. And what this education can achieve. In 2017, 172,000 people passed away in the United States, mostly young people, from issues related to opioid epidemic, mostly opioid overdose. This is an astounding number. That means in 2017, our nation lost 3 times more people than in 10 years of Vietnam War. It also means that every month in 2017, more people died from opioid epidemic than in 9/11. It happens across cultures, across social economic strata. Every day, 5,800 people, and this is old statistics, I believe it's more, unfortunately, but at least 5,800 people in the United States misused opioid prescriptions for the first time. Every day, 1,000 people are treated in the ER for prescription misuse, and unfortunately, I believe this data also dated, and unfortunately, it's even worse recently. This is one of the most popular pain management magazines called Pain Management News. Came out in April with the title "Opioid Overdose Now Leads to More Deaths Than Motor Vehicle Accidents." And obviously anybody who gets driver's license goes for the first time, goes to a course, takes precaution, checks the bells, checks the engine, transmission, safety, scoring of the car. But unfortunately, people don't get formal education on what they can do to stay safe, keep their loved ones safe, on what they need to do if they believe there is a problem, or how they react if there is a potential problem. What do you tell your kids if they are approached at school or in the mall by drug dealers, if they're friends using controlled substances? What happens if you have chronic pain and you are concerned that you can develop addiction? These are the topics of our channel, and we also go for different classes of opioids. We'll describe different addiction potentials. We'll talk about other controlled substances, and we will eventually talk about what can you do if your loved one is demonstrating aberrant drug seeking or addictive behavior, has been diagnosed, or what you can do if you have chronic pain and you want to prevent this problem. Let's start on what the problem is. What is commonly called addiction is named substance use disorder in DSM-5, which is obviously divided mild, moderate, and severe, with moderate to severe substance use disorder is equivalent to what commonly called addictive behavior or aberrant drug seeking behavior. And there are several components to this problem. There is a tolerance to medications, meaning that the person is high in higher doses to achieve a desired effect. Person feels withdrawal if he doesn't take the substance. And by the way, these phenomena are not unique for opioid medications. People can develop similar addictive patterns towards alcohol, towards benzodiazepines and other non-opioid medications, and even towards food, gambling, games, and so on. Craving for substance, unsuccessful efforts to cut down. Person spends excessive time in acquisition of this substance, and person has limited activity or social life because of use of that substance or activity. Now, even though many of this sounds obvious when it's clinically significant, or that we have the full picture of addictive disorder, at early stages, it cannot be so clear-cut, and we will talk on when and how to turn to professional and what can be done to assess and differentiate between different variations of the syndrome. Once the addiction develops, it's characterized by use of substance or activity despite negative effects. It means the person is aware of the negative effects, but nevertheless keeps using dysfunctional aberrant behavior or misusing the substance. There is failure to fulfill major role obligation because of use or aberrant activity, and there is recurrent use of substance or recurrent activity in hazardous situation. It's a compulsive behavior, and many people start with reasoning with a person without understanding that in many cases person understands the problem, understand the negative effects, understand the functional impairment and the danger involved, but nevertheless cannot stop the compulsive behavior. Our next topic would be to differentiate between clinical tolerance, which is normal, abnormal addiction, to look closer on these effects and to give you some instructions on what can be done if somebody around you, your loved one, your significant other, demonstrate these problems. Thank you so much for watching our channel. Please subscribe. Please, if you like the content, please give us thumbs up. It means the world to us. And I want to thank our manager, Shanae Houston, and Daniel Margolin for making this channel possible. Thank you.
Hey guys, like and subscribe our channel, please.
Thank you.
I'm someone who has been in severe pain now for, let's see, 8 years. And during those 8 years, I've got some pain relief, but never a lot of pain relief. And I was starting to get pretty hopeless. When you're in great pain for a long time, you really wonder how much you want to go on. And when you get someone who respects you, who listens to you, and who tries things that nobody else bothered to try, things start looking up, and all of life starts feeling better. And one of my great joys in life was helping other people, and I've been in too much pain to be a helper to other people. And now I look forward to getting back to life. So I really appreciate Dr. Margolin, and I think you will too.
Hi, my name is Lamar, and I've been coming to see Dr. Golden for about 5 years. He has always helped me with my pain because I have back pain, hip pain, and he has always been there for me. And I recommend anybody that needs help, come to Dr. Margolin. He's a true doctor, and he's a true friend. Thank you.